Hello, welcome. Let's see if this is gonna load for us. Okay, so my name's Amelia Davis. This presentation is for my NRS 211 class, and today's topic I'm going to be presenting is birth control and women's health. So just a little introduction into birth control. This birth control is also known as contraceptives, which prevent the act of pregnancy. But birth control is not taken for just pregnancy prevention. It's also used to control or help like heavy or irregular menses, period cramping, acne. So most used birth controls contain hormones, but there are some methods that do not include hormones. I'm going to be talking about the methods of birth control that do include the hormones. There are many different types and forms of birth control, so we're going to go over those. So the first one I'm going to talk about is oral contraceptives. This is a pill form. There's many different brands and doses available. So some contain estrogen and progesterone, and while other ones just contain estrogen. So the combined humoral contraceptives, this is also this contains estrogen and progesterone, while the mini pill just contains progesterone. So those women that are 35 and older and smoke cigarettes, is important that women are not taking estrogen birth control. Next, we have the IUD. This is a uterine device, intrauterine device. This is a T-shaped device inserted into the uterus. So this device usually lasts good for about 5 years. There's different types. Loletta, Skyla, Kylena, and Marina. Each of them are different sizes. There's also the birth control patch. Now, this is a patch that's placed on the body and it's changed once a week. This contains estrogen and progesterone. So, this patch you'll change every week for 3 weeks. And then the week of your menses, you don't have to wear the patch. And then the next week, you'll just put a new patch on. The Nuva ring, this is a small flexible ring inserted into the vagina. And this is changed once a month and it contains estrogen and progesterone. We have the Depo shot. This is an injection every 3 months. This contains progesterone, so this is a shot that the patient will have to come into office to do. Next, we have the Nexplanon, which is the implant. So this is a little small rod that's inserted in the upper arm and it contains progesterone. So this might be an option for somebody who can't have estrogen. So like maybe someone who's had like breast cancer before. The IUDs also only contain progesterone as well. Go to the next page. I have some pictures. So here on the left, there's two different IUDs. So there's a hormonal one, so the ones I listed, and then there's a copper one, which has no hormones. And then on the right, that's just kind of what the implant looks like and where it's going to go in the arm. Next, on the left here, I have picture of birth control pills. As you can see, there's many different types and brands. And on the right, I have an example of the patches. Here on this slide, I have an example on the left of a Nuva ring. So this is the ring that's inserted up in the vagina. And then on the left, or on the right here, I'm sorry, this is the Depo shot. So clinical implications. So there are benefits but also disadvantages of taking contraceptives. So it's important to let your patient know these. So like benefits of this would obviously be prevention of pregnancy. This can help prevent or lessen chances of acne. It can help lighten periods, shorten periods. In some cases, those may not experience any period. This is more common, like the IUD. They can reduce the incidence of cancer, reduce ovarian cysts, especially with the oral contraceptives, and it can also reduce anemia. So disadvantages, there's many side effects that can be experienced. So this include like spotting between periods, nausea, weight gain, breast tenderness, headaches and migraines, mood changes, decreased libido, vaginal discharge changes. So you could have increased discharge or lessen discharge. And then if you're just inconsistent with your birth control, it could lead to pregnancy. So research, evidence, and findings. Contraceptive is widely used in the United States, and it's estimated that 88.2% of all women aged to 15 to 44 are using at least one form of contraceptive during their lifetime. Of those women who become pregnant but choose not to, account for 90% of those who use contraceptive. So most women are taking it to prevent pregnancy. So common side effects of the combined hormonal contraceptives, the pills that I was talking about earlier, these are known to help lighter and shorten periods, so 40 to 50% reduction in menstrual flow, irregular bleeding, breakthrough bleeding, or spotting. It can cause no period at all. It can cause nausea, though. It can cause breast tenderness. It can cause headaches, reduce menstrual syndrome symptoms such as bloating and cramping, acne. So it may help with that. And it's also associated with a reduced risk of ovarian, endometrial, and colon cancer. And it helps with treating polycystic ovarian syndrome, as I mentioned before. It helps reduce cyst formation. So, research evidence and findings. So, the combination pill, this is the pill that contains estrogen and progesterone, is about 99% effective with perfect use, but with typical use, it's about 91% effective. The progesterone pill, or also known as the mini pill, is about 99% effective as well with perfect use, but with typical use, it's about 91% effective. The implant IUD and Depot shot is over 99% effective, and it releases progesterone to stop ovulation and thickens the cervical mucus. Now, the NuvaRing is about 98% effective with perfect use, but with typical use, it's about 91% effective. So, nursing practice. So, as a nurse, it's just important to perform proper evaluations of your patient. You want to offer them teaching about the different types of birth control options and the benefits and side effects that they include. So, teaching a patient how to place their NuvaRing properly, how to, make sure they're placing their patch on a dry surface on their body, not putting any lotion on the skin before applying the patch, making sure the patients take their oral contraceptives at the same time every day. So maybe giving them suggestions as like setting an alarm or keeping their birth control on them if they know they're not going to be home to take it. And it's also just, important to explain how to properly use each type. So, results and conclusions. So, it's just vital that the nurses in all settings and specialties stay current on the latest evidence regarding contraceptive. Therefore, like nurses can provide better patient-centered care, so they can address sub patients like family planning concerns and questions. So it's just important to have a doctor or healthcare professional, pick the best method for the patient and just provide the proper teaching and just properly explain the side effects and what the patient should look out for. And then this is my works cited page. So all the sources I use source from Cleveland Clinic. I used an article. I used some stuff from Planned Parenthood and some from the Nationwide Children's Hospital, and then all the pictures within the presentation are from Google. All right. Thanks for listening.